from the sprawling shantytowns and high skyscrapers of Lagos, into the deep jungle, and finally reaching a town called Owo. Here, the Greater Washington Society of Anesthesiology team is working with its partner organization, ProHealth International, to set up a free healthcare clinic that will provide a wide range of services to the surrounding population. Supplies donated by American hospitals are unloaded and ready for use during the week-long mission. The team establishes ties with ProHealth volunteers and also with the people who live in Owo. In a town that boasts 2 large hospitals, this mission offers the only chance many of these people have to see a doctor because they cannot afford to pay up front for medical care. There is no such thing as health insurance here. Word spreads quickly, and soon large crowds assemble on the hospital grounds, hoping to receive medical attention, some having journeyed many miles to stand in line. A system developed over the course of a decade imposes order on the crowd. Each person is seen in turn, questioned and evaluated, their medical situation assessed by volunteers. From here, the destinations for patients are numerous and may include trips to the pharmacy to receive antibiotics, vitamins, or pain medications, a visit to the dental ward, where a patient may receive dental implants, a screening session to assess the need for surgery, and for serious cases, the operating room, where conditions such as hernias, broken legs, and dangerous infections are treated. Meanwhile, volunteers trained by public health expert Dr. Michelle Rigaud fan out into the crowd, talking with patients about infectious diseases like AIDS and tuberculosis.
The HIV can be contacted, basically, it spreads mostly through sex.
Besides treating thousands of patients, GWSA volunteers serve as teachers to their Nigerian counterparts.
Get your thumb from under the cuff, under the gown.
Western sterile technique, surgical procedures, anesthesia technique, and organized data collection are just a few areas covered during the mission. The outpouring of support from the community speaks to the accomplishments of the mission and brings the volunteers a complete sense of satisfaction. Community leaders visit the hospital site. Local media arrive to cover the mission. As patients move from the operating room to the recovery ward, joyful fathers, mothers, and relatives express their appreciation for the free services.
I want to say that God will bless them in abundance, that God should take control of their life, and again, God will never forget them.
The familiarity, the relationship, the cordiality and everything, the love that they show to us, to this family in general, all the gifts that they give to us, the free ride to this place and everything. In fact, we give glory to God for the wonderful work they did for us.
Taking a look inside the home of this particular patient, a young boy who was treated for a broken leg, shows how little these people have to call their own. The mission is a source of hope, not just the hope of being treated, but the hope of a better future, aided by the kindness of strangers who take time out of their lives to help their fellow man. Your assistance is needed to continue these missions. By volunteering or making donations, you are contributing to a cause that has changed thousands of lives for the better.
I truly believe that volunteerism is the way to go. Nobody can be paid to do what we're doing, you can't pay enough for that. So if you can get doctors to agree, and this is the challenge I put across to doctors, you have 52 weeks in a year. Can you give us 1 week in a year to take you to a village to serve the poor and the underserved?
The Greater Washington Society of Anesthesiology and ProHealth International deliver the promise of quality health care for those who need it most. And, God willing, they hope to do even more in the future.